Hello again, everyone. Edwin Lerner back once again. In this YouTube segment, I'm going to be talking about the data connected with the coronavirus and COVID 19 as far as deaths and confirmed cases go. Now, the thing about this is, of course, we have data that we see on the internet that gives us numbers for confirmed cases and deaths that are associated with the coronavirus and COVID 19, but we know that those are not actually the true numbers because there's going to be a lot of unconfirmed cases connected with this. Now, the thing and deaths. Now, the thing is, they had Dr. Anthony Fauci was asked that how many more, I guess you could say by percent, do we have as far as confirmed, as far as cases of people with COVID-19 and deaths, and not asking about the confirmed cases because that, of course, is on record, but how many more by percent would we have as far as cases and deaths go? And he was asked something about this, but he did not want to really speculate on it. I think somebody had asked him, could it be as high as 50% more than what we're seeing in the statistical data as far as confirmed cases and confirmed deaths pertaining related to the COVID-19 coronavirus? I think he had stated he didn't want to say that he didn't know if it would be that high. It tells me he probably thinks it's not that high. I'm going to give a percentage. And what I believe in my gut are, I'm throwing this out a little bit arbitrarily, but I think for me, it seems like it could be about 20. We might have about 20% more cases that are not confirmed. Relative, in other words, relative to the confirmed cases. In other words, whatever the confirmed cases are, as far as the COVID-19, we would have, I believe there's probably about 20% more in addition to that. Some number I got, there was a website that had the worldwide total. It was almost at 9 million confirmed cases. I'm going to read it here. The number I had got, 8,735,974. And when I multiply that times 1.2, I get 10,483,169. So you could be looking at, there might be as many as 10.5 million cases total of as far as the coronavirus COVID-19, because I think that you're looking at about 20% more unaccounted for as far as confirmed cases and as far as deaths go. Now, I had looked on a blog. It was NPR.com. I guess it's nationalpublicradio.com. You might want to look that up and confirm it. But the thing about that is, it had stated in a blog on there that the people in the coronavirus, the coroners, the people that do the autopsy, were going to start to look at autopsies more for the corona to detect the coronavirus, if it was in the person's system or not at the time of death. Now, the thing about this is where things really get complicated. This thing is really a lot more complex and complicated than a lot of people may want to realize, because let's say, for example, that somebody were to die. I mean, you take cases where people have died during the time of this coronavirus pandemic, where whether it be from cancer or heart attack, I don't know if you could die from a stroke, if that's possible, but it's just or just dying from supposed natural symptoms, natural causes, some debilitating chronic illness, in some cases, whatever it may be. And the coroner says, okay, the person died from this. This is what the cause of death was. How many, I mean, in those instances, you could have in some of those instances where I believe the person could have actually had the coronavirus in their system, not necessarily been cognizant of it. They might have been in a very early stage of it. So a lot of these people that have passed away, it wouldn't surprise me if they had the coronavirus in their system. Doesn't mean they died from that necessarily. The autopsy report may be correct in a lot of these cases as far as what they had actually died from. But it doesn't mean that it wasn't in their system. You could have, I mean, there's people that are asymptomatic that might have it. They're not exhibiting the symptoms connected with it. And also, too, what worries me about these numbers that we see in the data online is that there was one instance, some of you may have heard about. It was controversial. There was something that happened in Florida where there's somebody that had researched some data that was working on this data for coronavirus in Florida, and she had claimed that the number was higher supposedly than what it was actually being reported by the state. And it just makes you wonder. You also have to wonder now, what about the other 49 states? Are those states reporting their data accurately? How much more can we actually have? Now, the United States has right now around 2.2 million confirmed cases. There was actually a website that actually had it close to 2.3 million right now confirmed cases of the coronavirus. If we go by that data and we were to say, okay, let's say there's actually 20% more cases than what's been confirmed in the United States as far as the coronavirus goes. You could be looking at close to around 2.7, maybe around 2.7 million, I think 2.76 million even, might be 2.8, might be around 2.8 million if you're taking 20% more than the 2.3 million and you're adding it to it. You could be looking at closer to I believe 2.8 million cases, because you might have a number of these cases again that can be unaccounted for. And it just it's really, I mean, who knows what these numbers actually are. And going back to these states, other states, is there any deception, or is there any fallacy connected with these states, with these numbers, as far as the data is concerned? And it just makes me really wonder and worry now. What are the actual numbers? Now, the United States, you're looking at the United States now as far as deaths go. The last report I had seen had it at about 121,000 as far as confirmed deaths go from the coronavirus in the United States. If you add 20% more to that, that would make the total around 146,000. But again, I'm speculating that there may be about 20% more people that have had this and that have died relative to the report, in addition to what has actually been reported. And because you don't have a lot of this testing going on in some places, these numbers, there really might be a very big disparity between the actual number of people that have gotten the coronavirus, that have died from it, in contrast to the numbers that are confirmed in those areas. So this is something, it's a very serious nature, people. And with the people that were talking before about, blowing this off and saying it wasn't that significant and more people died from the flu because of this, there was a report, I believe it was the United States, that there were more people that died from this in like a 3 or 4 month period from the coronavirus than the people that actually died from the flu during the flu season. At least the flu season, if not more, if not maybe for a year, in a year's time. So for me, for now we can all toss all that talk goodbye at as far as the flu is causing more deaths than the coronavirus. Coronavirus is very real. People are talking about a resurgence of it. We're not really out of the woods in this first one yet. And what makes this so complicated and complex a situation, we don't know if the second wave has actually hit us or not. And maybe it's already hit us, and that's why we're having such a hard time in the United States for this to actually be eradicated. Well, we can't really we probably won't be able to eradicate it completely without a vaccine, but for it to really diminish significantly, we're just having a terrible time in doing so. And what I think should be done, and I don't know whether it's going to be done or not, they should make it compulsory and mandatory that the people, the coroners, whoever is conducting the autopsies, need to test the bodies and see if there was coronavirus in the system or not. If they could test, see if they can test positively for it, so they can actually get more data and we could get a better idea and conception how much of a problem this really is. And it just makes me wonder, are people at least subconsciously afraid to do things which will reveal a more distorted amount of deaths connected with the coronavirus? It really does make me wonder if this is something people are just almost like the fear of the unknown is going on in a lot of people's mind. Like the unknown is putting people in a state of trepidation and fear, and maybe people just don't really want to see what the truth is. But we most of us will concur on one thing, that the numbers of the coronavirus deaths and cases are definitely higher than what the confirmed cases are showing in those areas. There's no doubt about it. And I think I think we actually have, again, not to be redundant, we have about 20% more cases than what the reports are showing. That is the number I'm thinking of. It's gotta be close to 20%, I believe. That's what my heart tells me. 50% is a little bit too much, but I think 20% wouldn't be that large of a number. It wouldn't be much of a stretch to say there's about 20% more of those cases as far as confirmed case, as far relative to the actual cases reported and the ones and the deaths. So anyway, people, that'll conclude this YouTube segment. Until next time, people, Edwin Leonard saying stay well.